Hello, I'm Selen Dirik, and today I will be presenting my final honors thesis, where we looked at CBD as a new treatment for alcohol dependence in rodents. So a little bit of background first. Alcohol use disorder has been a persistent public health issue, and individuals with AUD are offered limited treatment and therapy options. The insubstantial effectiveness of treatments presses for ongoing research to find new supplementary medications for AUD. And meanwhile, cannabidiol is a non-addictive and non-psychoactive substance with a strong potential to treat drug and alcohol use disorders. Specifically, it has various properties such as anti-inflammatory, anti-convulsant, and neuroprotective properties that make it relevant. And preclinical studies have shown that it suppresses alcohol consumption and motivation, as well as relapse-like behavior in non-dependent mice. And the gap that we're trying to fill here is looking at its effects, CBD's effects on alcohol-dependent rodents. So we want to look at a variety of treatment outcomes in our study. We want to look at CBD's effects on acute withdrawal from alcohol. We also want to observe if CBD can interfere with the development of alcohol dependence. And lastly, we want to see if CBD can affect alcohol-induced neurodegeneration in rats in the brain. So our hypotheses, given the previous evidence from non-dependent rat studies combined with the well-documented properties of CBD, we aim to see a significant effect of CBD on all three treatment outcomes in a beneficial manner. For our methods, we use two cohorts of 16 rats and put them through two models of ethanol consumption, which is utilized to induce alcohol dependence on them. And CBD is also administered in different manners in both models to look at a variety of treatment outcomes. Our first model is a chronic intermittent ethanol model, which is the current gold standard. And this model makes the animals dependent on alcohol through passive alcohol vapor exposure in vapor chambers. And with this model, we aim to look at the somatic signs of withdrawal-induced anxiety, and hyperalgesia to answer our first research question. And CBD is administered after the animals are dependent on alcohol in this model. And then the second model is the ethanol vapor self-administration model. And this model aims to have the animals voluntarily induce alcohol dependence on themselves through a no-spoke mechanism. And the animals are able to voluntarily self-administer ethanol vapor to themselves. And in this model, CBD is administered before and throughout the model. So before becoming addicted and throughout the entire process of becoming dependent. And in this model, we aim to answer our second question and see if CBD can interfere with the escalation of drinking that is observed in dependence. And lastly, the animals are sacrificed, and we do postmortem tissue analysis on their brains to answer our last question. So our results show that CBD animals demonstrated significant decrease in characteristics of withdrawal-induced negative emotional states. And this is the characteristics are the previously discussed somatic symptoms, anxiety, and hyperalgesia that we looked at in the first model. And this entails that CBD can reduce dependence-maintaining withdrawal distress. And then CBD also successfully decreased withdrawal-induced escalation of drinking in both models, which imply that CBD has a potential to decrease dependence-maintaining behaviors. But more importantly, from the second model, we can infer that CBD has a potential to interfere with the development of dependence through interfering with this escalation of drinking, even in voluntary induction of dependence. And lastly, CBD animals did show a significant reduction in neural death in the accumbens and striatum regions of their brains. This not only demonstrates the neuroprotective property of CBD, but it can It also suggests that CBD can influence neural mechanisms that underlie dependence, since both of these regions play a key role in dependence.